We're good.
Okay, here we go. Hey guys, we're back. Wanted to talk today about dermaplaning and kind of help with some of the confusion. You also hear this called dermablading. There's also a term out there called microblading, and that's referring more to the tattooing of the eyebrows. So just kind of wanted to get our terms clear, but we're going to refer to it as dermaplaning today. I have people call the office all the time for this procedure. Great for all ages. I want to explain a little bit about our goal, and then we've got Brooke with us today, a new friend of the practice, and she was so gracious to come in today. Do you mind if I tell your age?
No, go ahead.
Okay. She's 24. She's a baby. But this is a great procedure. People her age love it. While it's healthy for the skin, this age might really notice that they love how their makeup just slides on afterwards. Is that probably the thing you like the most?
Mm-hmm.
It's really great for the skin. As we age, our skin cycle slows, and while we notice the same effect, we're all getting these great benefits. I love my chart. Michelle, do you think I should bring this closer? Or?
Yes.
I'm going to just step in just a little bit. The biggest thing I want you to notice is, I'm blocking my pretty model here, but this is more of a 20-year-old
here.
Okay. This is a 20-year-old. It's a very quick skin cycle, maybe about every 2.5 weeks. Collagen's being produced, skin cells are going to the top, and very efficiently, she is exfoliating skin cells. And that's why, when you look at a 20-year-old and they look radiant and very glowy, their skin is just so healthy and efficient. Now, here's the 50-year-old. We're getting a lot more sluggish. We're pushing skin cells to the top, but it's not exfoliating on its own as efficiently. So dermaplaning comes in, and this is an area of dead skin cells. It actually gets a name, the stratum corneum, and we're going to use a blade to help remove that. So, I'll step back over here and we'll put away the chart. But what we're going to do is use kind of a surgical steel blade, and I can't encourage you enough to find someone with good training that does it all the time. And what we're going to do is manually lift that off. You will see the peach fuzz. She's just got, like we all do, it's called vellus hair, but a lot of us will just kind of refer to it as peach fuzz. That will come off at the same time. It will grow back as is, no darker, no coarser, but it'll give really a healthy glow to the skin. The other thing that people don't think about as often is if you're investing in really good products, you get better absorption, especially as we age. If we can do some things to help our skin do what it did on its own more efficiently, we just have to work at it a little bit harder, okay? So we'll put some gloves on here. You've had this done before, Brooke, right?
Yes.
And it's not painful, would you agree?
I agree.
Yeah, not painful. And then no downtime is something really great that you can come in, you can do on your lunch break. It's a great procedure for special events. So often I will do dermaplaning and maybe put a very, very gentle lactic on, and that gives a lot of radiance with no downtime. So great special occasion. So we've already cleaned her face really well. You want to do this on clean skin, no makeup, no oils, no products at all. And I'm going to go ahead and just bring our little blade out. Now, I do have patients, the minute I say blade, they get kind of nervous. As soon as I start, most of the times I just see their shoulders relax, and they often say, this is one of the most relaxing things I've done. So we're going to always start on the forehead and work towards the hairline. I'm going to pull the skin taut. And what I'm bringing up are skin cells and peach fuzz. And I often teach my patients, I love my purple gloves. Of course, they're latex free, but I love to put this out here and show everyone what we're getting off. And it doesn't mean when you get especially a little bit older patient will look at that and think they're not doing good skincare, and that's not the case. But you do get a lot of this off. So you can see the difference between vellus hair that's real fine and more skin cells that are a little bit more dense. How's that feel to you, Brooke? Okay.
Mm-hmm.
So very, very easy to do. The biggest thing, usually when people leave here, I tell them that they can go back into makeup. After having this done, so many don't. They say their skin feels so smooth, they just kind of want to enjoy it for a while. Now, who are people that should not dermaplane? Someone dealing with a lot of active acne. It can stir up acne, so I would recommend in that case really get with someone. I'd love to see you, but get with someone that can help with getting the acne under control. So that's one person. I do have some male patients, and this is not good for the bearded area. So a man might I have done a nice peel where you dermaplane right here in the cheek and on the forehead and temples, do a nice mild peel. But this area on a male would be prone to folliculitis. So that's an area we would stay away from.
I've heard people ask, will this make the hair grow back thicker or black?
It really won't. We just don't have, the right hormones to pull that off. So I've done it for years. Just being open and sharing everything today. But I mean, obviously I have dark hair, and it does not grow back. So you shouldn't be nervous about a procedure like this or a little treatment. There's no downside. I don't believe I've ever had anybody not like it, but let's say you try it once. The hair's going to grow back as is. Like we said, no darker, no coarser. You just wouldn't do it again. But I predict you would probably come in and do it again. Okay, and then just keep your eyes shut. And what I don't want to do is just have anything kind of just flake off and get in her eye. So we just do that for safety. Again, training's critical. I've done this for years. There's a certain tension you want to have on the skin. We have seen people come into the office and have what's called striping. So if someone maybe held too tight and they were too aggressive, we're getting a nice exfoliation of the skin, but you don't have to manhandle the skin. There is kind of a fine art to it. You doing okay, Brooke?
Mm-hmm.
And again, you can just kind of see it rolling off. Now, if we progressed and got on some really good products that help exfoliate would be, for example, tretinoin. Even more would be coming off, and I do recommend that people stop their tretinoin or Retin-A, which are the same thing, probably about 2 to 3 days before dermaplaning. So it just kind of keeps the skin a little too sensitive. Okay. Are we getting questions, Michelle?
How often do you have to do this?
I think what a good routine is about every 6 weeks. You don't have to do it that often, but chemical peels, superficial chemical peels with dermaplaning, ideal is every 6 weeks. I'll tell you, when I have patients that I'm gonna tell on our front desk right now, when I have patients that really kind of get on board and they do a chemical peel, they get on products, they do dermaplaning about every 6 weeks, they can tell out there. I've had Karen, our trusted person right up at the front desk, tell me, so-and-so's skin looks great. it's almost always somebody that's really committed to the every 6-week plan. Okay.
Can we see the blade again?
It's actually a surgical blade. It's a 10 blade. They've rounded it off on the edge. So a typical surgical blade has a point, and so for safety, it's really called a butter knife now. And they kind of round off the top there, and really nice to work with.
So how is that different than getting a peach fuzz shaver?
Good
From
question.
the drugstore.
Good question, because I'm getting that a lot today. I think those are getting a little more popular. With this blade and just the technique, I'm going a little bit deeper. So that chart that we talked about, the stratum corneum, I'm getting more of that off. I'm getting more and more questions about the little shavers at home. If you're satisfied with that, I mean, that's definitely getting the peach fuzz off. This is just doing so much more. So we go back to radiance of the skin and also getting more off so that good products absorb. So that is a good question. It's one I'm getting a lot. Okay. So just come around here. Obviously, you know, I go under the jawbone. We don't do the nose or just the very fragile skin right under the eyes. But everywhere else, we'll come back. I've kind of done right there. We're going to come back over here and finish the chin. And have you just turn this way. And we're going to kind of reverse the process. As far as now, I'll just blade towards myself. But you can just see it roll up. Is that exciting to hear, Brooke? It's just rolling off.
Brooke, does it hurt?
No, I love it.
Can you remember the first time you had it done? Did it sound scary to you?
Yes, it's kind of just like sandpaper, rubbing your finger against sandpaper.
Mm-hmm.
If that makes sense.
Yeah.
So all that is collected on her cheek, it's peach fuzz and what else?
And the dead skin cells. And, you know, somebody in their 40s and 50s, we're going to get a lot more off. Because at her age, she's still fairly efficient. So this age group, they love to, you know, they love how it looks. And like I said, the application of makeup, they really love that. And
like butter.
it does. It just slides on.
But for a 50-year-old, how is it different?
Well, we're getting, because their skin cycle is so inefficient, this is manually doing what her body is still doing for itself. So she's exfoliating those dead skin cells. Her stratum corneum is not the same as someone that's older. So we get a lot of questions on facials versus chemical peels, and I thought we would kind of touch base on that a little bit. You know, don't be afraid because our sign says plastic surgeons that it's all very harsh. We can do chemical peels that are gentle, but there's so much more than just a facial. Facial, most of the time, they feel great. People love to do them. They're very relaxing, and at best, I think they're moisturizing. But using a little bit more equipment, a blade, a little bit more of a chemical to kind of help wake the skin up, so to speak, I think you get so much more out of it.
Is there any danger in doing this?
It's just a low risk procedure. The biggest thing is it's always possible to nick the skin, but if you're really careful, you have a pattern. I've done this for years. I kind of have a pattern. I kind of go I know the contours of the face. I've just done it so long, but it's always possible to get a little nick. You know, if that happens, it's going to heal up in 24 hours. You know, it's just a very, very low risk. Big gain, low risk. We like those treatments. So, all right. So I'm kind of come up over your lip a little bit. still have the chin to go. Any other questions you can think of? Just always kind of want to be exfoliating. I think that's how we get the brightness to our skin. So dermaplaning, blading always go really well together. We'll come down and finish up your chin in just a second. How much more time do we have?
It's up to you.
Yeah. I think, look, point your chin up to the ceiling for a minute, and what we'll do, which might be kind of interesting, I like to do dermaplaning, but I love to do kind of, I guess what I'd refer to, my new name for it today is Dermaplaning Plus. I'm going to use a little mild chemical on here, if that's okay with you, Brooke.
Mm-hmm.
Okay. And we talked yesterday, you don't have any allergies.
No.
Okay. So what we're going to do is put just a little bit of what's called lactic. I love using this because, again, it's going to give the skin some radiance. It's a very, very mild, gentle solution. I'm only going to use my fan because it does have just a little bit of a kind of really medicinal odor. But now that we've got all that off, you know, think of us as we're working at a little bit deeper level. And this, you talk about something nice before a special occasion, you know, a couple of days out, come in, and we're just using this little fan just to kind of blow the smell away from her. I like the smell because I know what it's doing. I know it's doing such a good job, but, you know, it takes a little getting used to. We'll come to under your nose, last thing. And then really, what I'm going to do is let it sit here for just a couple of minutes. You'll see the skin pinking up. It's just really nice. I'll kind of go down into your neck just a little bit. And super nice. Okay, does that sting too much? It's mostly just kind of prickly.
Just like a tingle.
Just a little, yeah, a stingle. That's what we call it. So, used to the smell? Not too bad.
No, not at all.
Okay, all right. We're going to leave this on for just maybe a minute or two, take it back off, and then we can put some nice moisturizer on, and we'll really kind of have our finished result. So the biggest thing on dermaplaning, obviously, I would love to see everybody do it professionally. There are those little shavers out. If you're satisfied with just getting peach fuzz off, you know, you might be okay. But if you want to do more to your skin that's kind of a little bit more physician grade, you know, driven in a practice like this, I think you'll get more out of it. So it works really, really well. Let's take, you can see
Looks
how
beautiful.
Yeah, how her skin is just pinking up, and we'll take it off with plain water, and then put a little moisturizer on there. And this is something that anybody could do. If you know, if we weren't talking about it, roughly about 30 minutes, you could have this done, and then, you know, head back to work or do it on your way home from work. So I love this little peel. Certainly we have all kinds of peels that range from this being kind of the sensitive skin or special occasion, all the way up to, you know, big peels where you have sheets of skin peeling off. Those you're working more on pigment, maybe some for texture. But what I love about Brooke's young age, I have people that come in that wish they had started when they were 24. So if you have the ability to come in, do this every once in a while, really look at your products. You don't have to use a ton of things, just use a few really good things. And I keep promising this, but I'm going to have to get it on our list of topics. Is just teaching the difference between over-the-counter products and physician grade. And I think anybody that makes the switch over, you're not gonna see a huge difference in price, but you will in the outcome. Look how good her skin looks. Really, really pretty.
Did that hurt
Yeah.
at all?
No, I loved it.
She's making me look good because she's 24. So, so I appreciate that, Brooke. Thanks for coming by. But she just couldn't look any better. So a great routine is to jump back in here in 6 weeks, and for her age, that would be a really nice peel to do. If she had, acne, we would switch it. If she was working on pigment, we would switch to something else. But if you are just trying to get started doing really good skincare, this is a great way to start and put really 3 products. If I get someone young and they say, I can't do 18 things, but what would my base regimen look like? It would be an antioxidant, a prescription grade sunscreen, and a retinol or a retinoid of some type. Thank you so much.
welcome.
We're so
Thank you.
glad that she could come by. That is Dermaplaning. If you have questions, and we have kind of our services and things listed, I believe, on our website. But call in, make an appointment. I would love to meet you all. Thanks,
Bye,
everybody.
Brooke.
Thanks.
Bye.
Thanks, everybody.
I love whatever that was on my face.